Hello, everybody. Welcome in. We're going to give everybody a quick second to hop on right now. I think there's a chat here too, so go ahead and chime in where you're calling in from. Would love to hear that. So we've got Andrea from Maryland. Welcome in. We got Charles from Philly. I was just in Philly a couple weeks ago, actually. Beautiful city. And I was in Maryland last week actually too on a connection. I wish I could have stayed a little bit longer. Maryland's awesome. And we've got Miss Debra Nash. Well, we're these 30 minutes will go by pretty quickly, so we'll go ahead and hop right into it. Welcome everybody to our webinar on case acceptance. I'm Adam Sierra, and I'll be your host today. And today our speaker is going to be Miss Debra Englehart Nash. Debra is a dental consultant, speaker, and author for over 35 years, and she's spoken at major meetings nationally and internationally. She's also authored several articles for dental publications throughout the world, and she's recognized for over 20 years by Dentistry Today as a leader in teaching and consulting. Now, she's received several awards, including Top 25 Women in Dentistry and the Gordon Christensen Award for Outstanding Lecturer. I will go ahead and turn the time over to Miss Debra Nash. Give her a welcome.
Hey, hello, everybody, and thank you. You know, the older you get, the more recognition you receive. They figured might as well give her a award. She's still alive. So I still love what I do, and I love working with dental teams and doctors on helping them improve their communication skills with patients. Actually, I'm having a communication workshop here tomorrow at the Nash Institute, where my husband and I teach clinical courses as well as business courses and team communication courses. So I'm going to jump in. I have like 15 minutes to do what I normally do in a much longer period of time. I have a program called the 6 Critical Questions to Get Your Patients to Say Yes. And I'm going to do this. I'm going to fire hose you a little bit. So I'm going to invite you at the end of my presentation that there is some contact information. If you want some follow-up, I've actually written some articles on this topic. If you want some copies of the articles, I would be happy to do that as well. So I am going to launch in. I'm going to share my screen with you on a couple of things. Let's see that if that all happened. Share. Okay, there we go. So we're going to be talking about really quickly tools to improve case acceptance and collections. I'm not going to go into any sort of statistics in terms of key performance indicators, but Weave has a great program, a great technology to help you do that. And you really should be taking a look at not only how many new patients you acquire, how many that you actually attract to the patient, to the practice. You should also take a look at your retention rate. How many do you keep? How many, your attrition rate, how many actually leave? But most importantly, once you do acquire that patient, what are you doing with them while they're in your practice? So you should be really kind of targeting for anywhere about an 80% case acceptance rate is a high performing dental practice. In the 70s is an average performing dental practice. When you are in the 85th, 95th percentile of case acceptance rate, you are a absolutely top performing dental practice. And I really want to emphasize that when we're measuring it, we're not measuring the treatment that you actually presented, but you're actually measuring the treatment that was accepted. So that's the differential. What treatment are you presenting versus what treatment is being accepted? And the critical piece is what's being accepted, and that's what we really want to look at. I have heard, especially in the past few weeks, about what is going on. Is there a downturn in our industry? What is happening? Is the whole tariff situation affecting dentistry? And so I actually did some statistical review. And this is what I discovered. I did this is absolutely totally current and relevant. Here is what is happening. They are lumping dentistry into wellness industry. They consider us a wellness industry, which I think is awesome. And I think we should use that term, dental wellness, with our patients, as opposed to, dental care. I mean, that's another way we do that. But dentistry is considered a wellness industry. I like that. And they're actually saying that the wellness industry is going to reach $7 trillion in spending, consumer spending in 2025. So that's good news for us. That means people are willing to make purchases on, and let's talk about that, on what they choose. And I think that's the critical piece. 80% of the reason why patients choose your care has nothing to do with the capabilities, the clinical capabilities of the dentist. Now, Some of you may or may not know this. I am married to a dentist, and for right now, I may have invalidated myself to some of you. Ah, she's a dental spouse. I promise you, I was not a dental spouse first. It came after, and he was not a client. So it had nothing to do with my work in the industry. But I will tell you that the most patients have no idea about the clinical abilities of the doctors that's treating them unless someone tells them. And the last person on earth should tell the doctor that they're great is whom? The doctor. Can you imagine having a doctor walk into an operatory or consultation room getting ready to examine a patient and say, "Hi, I'm Dr. Sierra, and I'm really great." I mean, that would not go over very well, I don't think, with a patient. But when we talk about that, when we talk about who can endorse the doctor and help the patient understand and appreciate, and who validates the doctor's abilities, and that would be my entire team. From the moment, we don't have time to go through all the process. That's a course in itself. But from the moment the patient calls the office till they get into the reception room, till they get into the operatory, that team is endorsing that provider, that dentist, that practice every step of the way. And that's what is the culture? What is the purpose of the practice? Tell me, what are the attributes of the dentist? What makes them exceptional? And it may or may not, it's certainly the clinical abilities, clinical aptitude is an important part, but it's also, what is their chairside manner like? How caring are they? How integrous are they? What is their strength of character? And that needs to come from me, the team member. So I become the second opinion. When we're talking about case acceptance, I become the second opinion in the dental office. If you think about this, and those of you who are listening who work in a dental practice, how many times has a patient turned to you and said, "Should I do this? Is she good? What do you think? Is a crown the same as a cap?" And what will my insurance cover? And we can talk about as much as we can in 15 minutes, all of those objections or concerns. So I really think it's my responsibility as the team member is to find that way to connect with the patient, and that truly will improve case acceptance. And I think that's an absolutely critical piece. So what are the action plans and the action steps that I often make, and probably majority of my presentations are always, what are you doing to endorse the practice? What are you doing to endorse the doctor? What are you doing to endorse the treatment plan? And that absolutely moves you toward a greater case acceptance. So I also think that it's really important that patients don't buy procedures. And here's a term that I like to remind my audiences about, my participants about, my clients about. What we do for our patients is relational. It's all about relationship. What we provide is a transaction. So if we think about this, my first step in gaining case acceptance is establishing a relationship, which leads to, if we do it well, it leads to the transaction, which is the dental treatment. So it's simple. And oftentimes this is what happens, that when a patient calls your office, we have a tendency in some offices to talk about the transaction. You're going to have a new patient examination, and we are going to do these procedures during that examination, and we go through the menu of what is going to be accomplished, the transactions that are going to be accomplished during that process. And I'd like you to really reconsider that, because really what we really want to talk about is how you are going to feel while you are in our care. So you might want to say things like, we are going to do our very best to help you receive, or I'm going to say, we're going to give you all the information you need to help you make the right decisions. We're going to make sure that you feel comfortable and confident that you've chosen the right office for your care. Those are those relational conversations as opposed to the transactional conversations. I will get to the transaction once I establish relationship. What makes you different would be, and oh my gosh, I have to to talk about this, and I might bump a little bit over a minute over my time. But oftentimes the patient calls, and the first thing we ask is, what insurance do you have? That's a transaction. That's a process. That's not relationship. And some of you may be asking the question, you might be typing the question, what do you say to the patient if they ask about insurance? And here's what I will give you. And if I'm hopefully this is being recorded. If it's not, and if you're on a cell phone, hit record. Here's what I say to patients if we're talking about the procedure or the process of insurance. I'll be happy to tell you how we handle insurance. We will do our very best to help you receive whatever allowance your employer has provided for you. However, we will never compromise our standard of care based on any exceptions, exclusions, or limitations of any particular plan. And whether or not you do participate in network or you participate out of network, I think it's important for us to be able to have a useful conversation with the patient about what insurance will and will not do. And that actually improves our case acceptance rate as well. So we get comfortable talking about what insurance and how the part that insurance plays. It's a supplement. It's an allowance. Please avoid saying things like, we're going to do our best to help you maximize your plan. No, we're not. We're going to do our best to help you receive whatever allowance that's being provided for you. And so I think that's important. I also think when we talk about case acceptance, if you don't tell them what you have to offer, they will never choose it. Sometimes when I go visit dental offices, there are assumptions that are made whether or not the patient can or can't afford the treatment. And sometimes the treatment plan is limited, or we say and none of you on this call, not in this meeting, would ever say this, I'm sure. But I have actually heard offices when I go in visiting in offices as a consultant, I've heard people say, we'd really like to do this for you, but your insurance won't cover it. Wow. So I would say we have to get rid of those limitations that we have and making the assumptions that the patient will or will not choose it. And because we assume the patient won't choose it, we don't talk about it. Well, the patient will never know what you have to offer if you don't tell them what you have to offer. So I think it's very important for you to comprehensively explain your treatment plan. And you're going to say, oh my gosh, why do you have these pictures here? I'm going to be as quick as I can about these. I'm watching my clock. I'm watching my slides, but these are really important people. I was doing this presentation a couple of weeks ago, and they said, what's with the dog? This is where I learned to have a magical question. If you get nothing from my 15 minutes, this magical question is going to change your life in case acceptance. I promise you. And it was told, my husband says it all the time. And it was actually, this question was used when we were buying this waterfall and this pond in our yard. I won't go through the whole story. I don't have time for the whole story. But as we were looking at, we were actually asking to have a water pond filled in. That's all we wanted. We wanted the pond filled in. It was probably going to be a $500 procedure. And the person came out, and instead of him listening to us saying, we only want, how many times does that happen in your office with the patient says, we only want this, or we only want what insurance will cover. We only want what insurance will allow. And instead of him going to us and saying, we only want you to fill in the pond. He said a magic question. He asked us this magic question, and this is a game changer in the dental practice. Would you allow me to tell you what I'd like to do? So imagine this. Rather than telling the patient what they need, rather than sitting down and saying, here's your treatment plan, here's what we found, here's our diagnosis, here's a treatment plan, you are going to do your exam and you're going to do your diagnosis. And then when you sit with the patient, your body language is relaxed, you're leaning slightly forward, and you look at the patient in the eye. You don't look at a computer screen. You're not looking down at a piece of paper with a treatment plan written on it. You look them in the eye and you say, Nate, would you allow me to tell you what I'd like to do if you were my brother? I have never heard a patient say, no, don't tell me. I have never, typically, I always hear the patient say, yes, please tell me. If you incorporate this question when you're getting ready to present your treatment to patients, would you allow me to tell you what I'd like to do? My husband says, would you allow me to tell you what I'd like to do if you gave me carte blanche? That's his comfort. So find that how you would end that if you were my brother, if you were my sister, if you were a member of my family. Would you allow me to tell you what I'd like to do? And you are going to have more compliance and a better listener with the patient. And I think that's important. I also think as we quickly segue, and I have about, I think, maybe 2 minutes left, and if I don't, I'm taking them anyway. The decision to accept treatment is the responsibility of the clinical team and not the financial team. So oftentimes the patient is escorted to talk to the financial coordinator or the ambassador when it's way too soon. They're not ready to talk about money because they're really unclear. They really haven't said yes to the treatment. They haven't said yes to the treatment acceptance. So we really have to make sure that we have been very clear with the patient on how we're going to move forward, how they want to move forward. A phrase, not my own, and I don't even remember. I'd love to give credit to where I heard it. The confused mind always says no. So if I'm not sure what you're asking me to do, if I'm not sure what you're proposing, if we haven't come to a clinical agreement, that I'm really not ready to talk about money. And so oftentimes I think we release the patient too soon to go and have a clinical conversation. We also, and I made myself a note as we were starting this time, we have to make sure that we have a beautiful transition from that clinical team to the financial team to have that conversation. If a patient starts asking about money at the chair, first of all, that's good news. That is not a barrier, that's a portal. So when people start asking you about how do I pay for this or how much is this going to be, celebrate that because that means that they are interested. Now they've kind of put it in their mind that they're ready to move forward with care. Now they want to figure out how they're going to find a way to afford it. So that we can say, you know, we have Kaylee on our team, and she is a master at helping our patients find, you know, discover resources and how they can make their investment in this. So when we're ready to talk money, we do take them to that expert person. Avoid saying things like, "I'm sorry, that's not my job. I'm sorry, we don't talk about money here. I'm sorry, we don't know our fees." You know what? If you're ready to move forward with your care, and we need to work out those the financial resources, if we need to have, if you're ready to have that conversation, then let's go ahead and bring in our expert, who's Kaylee. She is great at helping our patients find a way to take care of the care that they choose. So once again, not the care that they need, the care that they choose. Be careful in your words. I don't buy what I need. I buy what I want. I buy what I choose. So be careful about your words. So I think really is also important to this, and I'm almost getting close to my end. I think this is also really critical. Never project your own financial limitations onto the patient. So sometimes we present treatment in our mind. We're thinking, man, I can't afford this. Man, I don't know if I could do this. Man, this seems like a lot of money. Wow, they want, you know, they want to do cosmetic dentistry. And I'm trying to make my mortgage payment. And so, once again, I actually heard this from someone else. Don't sell from your own wallet. Don't make assumptions based on what you can and can't afford, or what you would or would not choose. Don't, you know, put that onto the patient. Offer your best. Offer what is your purpose? What is it you want to provide the patient, and move forward with that. So be careful that we don't project our own financial limitations onto what we think the patient can or will not choose and make assumptions based on that. I think that's a critical piece. So when you are presenting your treatment plan, I want to say this: avoid the paper. We have a tendency to hand the patient, you know, a piece of paper with our financial arrangements on. We say, here's your treatment plan. Here's our financial policy. So we do have financial protocols and standards in our practice, absolutely. But if we hand the patient all of the options and we say, here are your options, you can pay all of it, most of it, some of it, or you can, you know, sign up for a payment plan, you have lost your ability to negotiate. So financial arrangements is a art of negotiation. When I present my preferred option first, and I say it in a way, something like this, you know, we have found that most of our patients prefer to take care of the total treatment fee at the initiation of treatment, and they get that out of the way. A lot of our patients really appreciate the resources we have for them to make payments over a period of time for treatments such as this. So we make that offer first, and we wait and we pause and wait for the patient to respond. What do they have to say? What do they want to say about that? And then once again, if we start negotiating what we want them to do or what they choose to do, the very last thing that we're going to ask them, and if the patient says, well, can I make payments on that? Of course you can. Tell me what you have in mind. Never assume when they say, can I make payments on that? It means they want to make $10 a month payments into perpetuity. A quick example, my husband does a full mouth rehabilitation with a patient. It was a $62,000 case. And she said, can I make payments on that? And my question was, of course. Tell me what you had in mind. And she said, can I make 3 payments of $20,000 each over the next 6 weeks? I think so. I think that would work. So once again, be open to negotiation as opposed to presenting your options first. You have them. You know what your boundaries are. You know what your limitations are. Present your preferred option first. Wait to give the patient an opportunity to respond. And then you present your next option second and move along down all of your options, finding the right option for your patient. And I think that's a critical piece. So here would be the question as I'm rounding up. I know I'm a bit over. So here would be a wonderful question to also ask patients. If we could find a way to make this care affordable for you, what other concerns do you have? So once again, avoid handing the patient a form with your payment plans, because then you lose your ability to negotiate. So this is the art of negotiation, and it's obviously with your comfort and your ease and how you do that. I think it's also important, very, very briefly, this is my last slide, that you have a system to reach out to patients, and Weave can help you with this. Oh my gosh, we can help you with all of this. How do you reach out to those patients who say, I'm going to have to think about it. Let me check with my schedule. I need to figure out my financial resources. Don't wait too long. You're not calling to schedule them. When you do your follow-up phone call, here's what you're going to say. I'm going to say, Nate, we covered a lot of information today, and I know you have, these are important decisions for you. And here's what we have found. We have found that some of our patients pull out of the parking lot, and then all of a sudden these questions that they wish they had asked come into play. And they think, oh, I forgot to ask this, or oh, I wish I had known that. Or so we always call our patients so that we make ourselves available to answer any questions that you may have after you leave our practice and when you go home this evening and share your experience with your family and your friends. So as a courtesy, if we haven't heard from you in the next few days, we will initiate a follow-up phone call and make ourselves available to answer the questions that you had after you left. So I think that's really important for you to have that system. You're not dialing for dollars. You're not calling when you have downtime. You are making it as part of your schedule. It's part of the process with your patients. Wow. Whew. That is fire hosing all of you, but I'm hoping you received at least 4 to 5 tips on how you can improve your case acceptance and improve your collections. So thank you so much, Weave. Don't know what I'd do without you in our industry. Thanks for letting me be part of tonight's program.
Well, thank you, Deborah. That was absolutely outstanding. And every time I hear you talk, I learn a ton. And I know that everyone here is learning a ton as well. As a reminder, feel free to drop any questions that you have in the chat. And I'd like to turn the meeting over to Nate Nelson now, who has some really great information for us.
The thing is I could talk about this for like 4 hours, and Adam knows that. And so I'm going to go as quick as I can. But the other thing that I'll say is I could listen to Debra Nash all day long. I don't even know if Debra knows, but about 12, maybe 14 years ago, Debra and I played in a foursome in a golf tournament here in Utah. And it was fantastic. And so I've known her for a long, long time, and we've both been in this industry for a really long time. So here's what I want to do. I just want to reinforce everything that Debra said about, especially the thing about people are buying your practice, not necessarily the procedure that has been recommended. And part of that is all about the relationship that you're able to create. And that includes everything, soup to nuts. And so she mentioned on here that it starts at the very beginning of your interaction with them and it goes all the way until the end. And so one of the things that we like to say here at Weave is that Weave handles everything from the first phone call to the last payment collected. In fact, I've got a pretty good slide, and I've got to skip through a few here. That we love this whole patient experience journey. Is everything that Debra was talking about. Whether that's increasing your patient acquisition because you need to replace some patients or you need to get more patients, all the way through accelerating the patient engagement and through increasing staff efficiency and then generating that additional revenue through treatment plan acceptance. All of that can happen directly within Weave. And that's part of the thing that is most exciting about what we can do in order to complement what you guys are doing in your practice to provide exceptional dental care. So those are the only slides I'm going to present because I'm going to actually just dive right into our product. Hopefully this works out well for everyone. This is Weave. If you haven't seen Weave, it's beautiful. It's clean. It's very easy to use. It actually can be shrunk down and live right next to your practice management software. It can also be made big in just one single click. in order to really understand what's happening inside your practice. But a couple of the things that I wanted to show really quick in relation to what Debra actually talked about. If somebody is calling your practice, and this is kind of the benefit, you'll notice what's happening is this pop-up comes up, and if you click on it, it's going to tell you everything you need to know about that patient before you even answer the phone. And so when we're talking about being responsive, when we're talking about creating an environment where that patient can really understand that they're being taken care of by you, when you pick up the phone, you can say, "Oh, hi, Nate. It's nice to see you. I noticed, that you have a payment overdue, or that we've got your a couple of forms missing. We have a note in here. Maybe, this person recently had a child, and you can add a note into into their account, so you can actually have a really decent conversation with that patient and know them exactly. I really love this kind of thing. This is something that we've included in our patient profile. Hang on. We're going to go to the payment. So Nate has an outstanding balance of $100. The second he calls in, I can go, "Hey, Nate, notice you had an outstanding balance. Can I just go ahead and take that payment right here inside of our system?" This is a demo account, so hopefully we're just going to, I'm also going to try to remind the patient. I'm not sure what's going on with that. But you can see also right here how much that patient owes you directly on their patient profile. And you get all this information before you even pick up the phone. One of the other things that I loved that Debra talked about, and I know I'm down to 2 minutes, but here's another kind of interesting thing. If I call the office and I miss that call because maybe I'm busy, it's going to pull up immediately. And I wish I could show you my cell phone. Here's my cell phone. But it sent an automatic missed call text. Now, if I'm someone who is really interested in having that relationship that's going to close a treatment plan, I want to know that this person is going to respond to me really, really quickly. So now if I'm the practice, I can say, "Hi, how can I help?" And that automatically reaches that patient where they live, not on their phone. Maybe they're busy too. And so if you send a text message directly back to that patient, then they have the freedom to text you back and forth as well. I loved what she was talking about having that unscheduled treatment plan follow-up. You can automate that within Weave. Or you could just send a text message. Quick story. I know I'm down to 1 minute, but quick story. I went to get a consultation about fixing my teeth because I don't love my teeth. I went to the practice and they gave me a recommendation. They handed me the paper and everything, and it was so much money. I was like, I don't think I'm going to do this. If that office would have had Weave and would have sent me a text message or 100 text messages over the last little while, I think I probably would have thought about it more. I think I would have gone back in for that treatment if I knew that they were automatically thinking about me, worried about my care, making sure that they were kind of taking care of me. So I think I'm out of time. These are just a few ideas, and I want to go back to this slide really quick because we hit every single point on the patient journey to create that relationship, to create the responsiveness that you need to have in order to close the deal, to close the procedure, and then also get paid for it. So we're very excited about working with Debra. We're very excited about working with you. If you want to see more, call a rep. And we are happy to walk you through the entire experience of Weave. So thank you very much.
Thank you, Nate. That was awesome. And thank you, Debra, for giving an amazing presentation. Thank you to each of you for joining us, taking some time out of your day to spend some time. There will be a recording of the webinar that will get sent to each of you. As always, you can feel free to reach out to us with any questions. And until next time, y'all take care, stay happy, and take care of each other. Have a good night.